everybody. Thank you for coming. I'm Lisa Schaffer, and I'm here tonight to basically introduce Dr. Schaffer. As you can tell, our names match, so we're married. And Dr. Jim is what we call him. And Dr. Jim has been a chiropractor for 23 years, 24 yet? 23 years, long time, graduate of Penn State University and Penn State Chiropractic School when it was here. We've had offices in Westchester and Phoenixville, and what Dr. Jim likes to focus on really is the health of your body and having the whole thing function together as one unit, because this body that we're in is it's a self-healing machine. So what he's going to do tonight is talk to you a little bit about some simple ways that you may or may not heard of. Sometimes we watch light bulbs go off, about how you can help to keep your body healthy and strong. Anything else?
That's good.
Okay, that's our son back there too, the guy eating the chips.
One of them.
Yeah, one of them. He's my helper, he's been carrying stuff tonight. So I open it up to you, thank you.
All right,
Good
well,
job.
thanks for having me. All right, so I'm going to show you a video first, and it's a great video. And then I will talk more specifically about the body, the nervous system, and also some things you can do at home to avoid, you know, if you already have low back problems or you have neck problems, as far as ergonomics. Now, in today's world, so many people are pretty up to date on their ergonomics, especially at the workstation, in the office. But I'll also go over what you can do at home, because your posture will play a big part to the health of your spine. And I'll get more into detail with that. But initially, we're going to go down under and listen to an Aussie, because he explains it very well. So it's a little entertaining. I like it because there's a lot of great visuals.
What do you think of when you hear the word chiropractor? I know a lot of people immediately assume there's someone you only see when you have a sore neck or back. But that's a myth. What we're going to do is tell you the real truth behind this proven scientific healing art. You'll get a greater understanding of chiropractic healthcare and perhaps be given a new perspective for a different and better way of living. This may be the missing piece of your healthcare puzzle. So what's the big idea? Well, the big idea is your central nervous system. Your central nervous system is made up of your brain and spinal cord and is continually monitoring and coordinating every single function in your body. If you think of the brain as a central computer that controls and coordinates all the functions of your body, then the nervous system is like a communication network that relays messages back and forth from the brain to different parts of the body via the spinal cord. The spinal cord is a long bundle of nerve tissue which extends from the lower part of your brain down through your spinal column. Along the way, smaller braids branch off from the cord and pass out from the spine between each of the movable vertebrae. These braids divide again and again into tiny nerve fibers and fill the entire body, going to each cell, organ, and tissue. Every human has an estimated 15 billion nerve cells, sending and receiving messages through the spinal cord. Now, our nervous system is extremely delicate, so what protects it? Our spine. This is what a normal healthy spine looks like. It has 24 movable vertebrae, each working with the one above and below it. A disc separates the vertebrae and acts like a shock absorber and a spacer for the nerve. So why is a healthy spine so important? Well, it protects the spinal cord and the delicate nerve tissue and allows us to bend, flex, twist and move freely without compromising the nerves. If the spine is not moving freely, it's referred to as a vertebral subluxation complex, or for short, a subluxation. Is that right? Subluxation. Is there another word we can use for that? No? Okay. This is when two or more vertebrae have lost their normal motion and or position. This can cause interruption to the normal nerve flow and interfere with the communication from the brain to the body and from the body back to the brain. Research at the University of Colorado found that it only took between 8 to 10 millimeters of mercury pressure to reduce the nerve supply by up to 60%. That's about the weight of a small coin. Compression can exist without pain,
So that means where the nerve goes to can be robbed of up to 60% of its nerve supply, and you may not even feel it. This is what is referred to as a silent subluxation.
Even slight pressure on the nerves can alter the quality or quantity of the messages being sent.
It can slow it down.
It can speed it up.
Or it can distort the nerve messages to and from the brain. At the tissue and cellular level, the interrupted flow is sometimes inadequate for the demands of the body. As you've just experienced, when there's a communication breakdown, it's really hard to understand the message. So what happens when you have a subluxation?
That area can start to degenerate in as little as 2 weeks. This degeneration causes scar tissue to develop, which leads to more scar tissue. This degenerative process can continue as long as the immobilization is present, and this type of degeneration is preventable.
Spinal degeneration has nothing to do with how old you are. You can be 60 years old and have a perfectly healthy spine, or you can be 10 and have a spine that's already showing signs of degeneration. It all depends on how and when the subluxation occurred. Subluxations can interfere with normal communication between the brain and the body.
So for example, the nerve supply from your neck goes to the immune system, pituitary glands, sinuses, face, middle and inner ear, eyes, tonsils, teeth, neck and shoulder muscles. The nerves from your thoracic spine go to your arms, hands and fingers, heart, lungs, gallbladder, liver, stomach, pancreas, spleen, kidneys, small intestine and lymph glands. From your lower back, large intestine, appendix, abdomen, sex organs, uterus, bladder, knees, prostate, lower back and leg muscles, and that's just naming a few.
Okay, so now you know where they go. What does that mean? Well, that's a good question. If the nerve supply to anywhere in the body is disturbed, it can eventually lead to a symptom. Symptoms are the only way for your body to let you know that something's wrong. So let's go back to the same spine again.
If you have nerve interference in the cervical spine, it can lead to headaches, migraines, lowered immune system, sinus troubles, hay fever, abnormal sleep patterns, eczema, hearing loss, tonsillitis, chronic cough, croup, pins and needles into the arms and hands. In the thoracic spine, asthma, functional heart problems, bronchitis, influenza, gallbladder troubles, liver conditions, blood pressure problems, indigestion, heartburn, gastritis, lowered immunity, allergies, kidney troubles, chronic tiredness. In the lower back, constipation, menstrual problems, bedwetting, knee problems, sciatica, backache, poor circulation, swollen ankles, weakness into legs and cramping. Wow, I'm out of breath, and that's naming only a few.
Did you know that less than 10% of your nervous system perceives pain? So quite often, by the time pain and symptoms appear, the nerve interference could have been present for months or even years. Think about when a person has a heart attack or a stroke. They don't actually feel the arteries blocking up and usually don't know anything's wrong until it's too late.
Painkillers and anti-inflammatories can cover up the symptoms, but they don't get to the cause of the problem. By masking these symptoms, it allows the problem to continue to develop silently until there's a major health crisis. We all know about the damaging side effects that can occur from long-term drug use. So why continue filling your body with drugs to hide the cause of the problem?
Now you might be wondering what causes subluxations to occur. Gardening, sports, computer work, pregnancy, improper lifting, arguments, food additives, chemicals, birth, poor posture, to name but a few. There can also be mental causes, such as stress. The average 5-year-old has had approximately 2,000 falls, of which 200 are considered serious. But usually an isolated event alone is not to blame. It's an accumulation of many of life's little incidents and accidents. Recent research has found that in births that required intervention by a doctor, which means they used forceps, suction or excessive force, 95% had upper neck injuries. So it's a smart decision to have your child assessed at an early age.
So the chiropractor's job is to locate and correct spinal interference so your nervous system can perform at its own optimal level. Remember, the immobilized area will degenerate at a faster rate than the area with good balance and movement. Fortunately, with the right care and by mobilizing these areas and creating good alignment, the body can begin to slow, stabilize or reverse the degenerative process. Chiropractors assist the healing process by re-establishing the nerve flow to its optimum level. This allows the proper communication between the brain and the body. Chiropractors don't treat the symptoms. Rather, they remove the nerve interference, which allows the body to do what it does best, heal itself. When you get a cut or a broken bone, who heals it? Your body does. Research shows that families involved in regular chiropractic care experience less pain, get sick less often, miss less school and work, and function at a higher level of health. In other words, they have a better quality of life.
A study by a US insurance company showed that clients who used chiropractic used far fewer medical services. On average, hospital admissions were down by 60%, hospital days by 69%, outpatient procedures down by 85%, and pharmaceutical costs by 56%. That's huge. The Journal of Pediatrics found that chiropractic is the most used alternative health care for children. Millions of families choose chiropractic care not only for fast relief, but to achieve peak performance and a lifetime of wellness. In 1979, the New Zealand Commission of Inquiry into Chiropractic released their report. After 18 months of research, they concluded that spinal manipulation in the hands of a registered chiropractor is, quote, remarkably safe. They also commented that chiropractors are the only health practitioners who are equipped by their education and training to carry out spinal manual therapy. These days, you should have a healthcare team made up of a chiropractor, dentist, optometrist, an exercise and nutritional coach, and a medical doctor. We all know that nutrition, exercise, and a healthy state of mind are essential for your total health and well-being. You can go for days without food and water, minutes without air, but without a nerve supply, life cannot exist. Nothing happens in your body without the involvement of the whole nervous system. So we hope you now have a greater understanding of the truth behind chiropractic healthcare and the impact of subluxations on a fully functioning nervous system.
The most current research is now telling us that we will be living to 100 and beyond, whether you want to or not. How your health will be when you get there is your choice. Only 30% of your health is genetics. The rest is up to you.
How much is your health worth? Ask anyone who is experiencing or has experienced health problems in the past, and they'll tell you, your health is priceless. All forms of the healing arts have their place, and let's face it, medicine has an important role to play in crisis and emergency care, and in these situations can be life-saving. On the other hand, chiropractic is vital in keeping your body functioning at its best possible level by removing nerve interference and allowing the body to heal itself. So for health, wellness, and quality of life, chiropractic is the smart choice for you and your family.
Okay,
Turn the lights on.
sure. All right, so, what did anyone have any comments about what they saw? New to anybody, this information? Has
I was
anyone,
thinking I had about 80% of this problem.
with the body, with how it's
With the back,
functioning?
with the
Yeah, I mean, it's
back.
not always a cause, but we take a look to see if there's any sort of nerve interference going on. That's really our focus. So whenever a patient comes into our office, we look at two things. We want to see the position of their spine, and we want to see the condition of their spine. Because research shows, so just looking at the spine. So your spine is made up of 25 movable bones, and that includes the sacrum. And each vertebrae, each one of these bones has 4 joints. It has 2 above, 2 below. So when you look inside these joints, this part of the bone, I don't know if anyone can see this, but this part of the bone is covered with like a Teflon covering. It's called cartilage. And so is the underside of this bone. So wherever our bones meet in these joints, they have that cartilage covering. And it allows frictionless movement as we twist and we turn. The body also provides fluid in there. It's called synovial fluid. And it brings nourishment to that cartilage. And it's all contained in there by muscles, tendons, and ligaments. And it's like a capsule. And these are referred to as joint capsules. And then from the side, when we look at our spine, We have separation by our discs, and they act two ways. They are a shock absorber. They're also a spacer. The healthier the disc, the better this space. The size of this space will have a direct effect on the size of this opening where the nerve comes through. If this starts to wear down, this hole becomes smaller. You probably have heard of it. It's called stenosis. Okay? So that hole will get smaller. This will wear down. Majority of the time it's called osteoarthritis. So I'm going to explain that in 1 second. Other things that can cause this opening to become smaller is if the vertebra rotates and gets stuck out of position. So if the vertebra rotates to the opposite side, this opening becomes smaller. If there's lateral flexion, it also becomes smaller. So when we look at the spine, when the spine is lining up, is close to neutral from behind, it ends up distributing the weight equally across our joints and across our discs. From the side, we should all have a certain amount of a forward curve in the neck, backward curve in our upper back, and forward curve in our low back. And that's really where we get the spring to our spine. So when we're walking and we're doing things, that is what's handling that force. From behind, we want it, as I mentioned, straight because you distribute the weight equally through these joints. Now what can happen, whiplash accidents, if someone gets hit from behind, the first thing that happens is their head goes back and then it whips forward. It ends up stretching and tearing, and it can be micro trauma, micro tears, but the person loses that curve. And there is so much research on whiplash accidents out there, and every case there is a loss of curve depending on the amount of force that patient has withstood. So we see this often in our office where when we take an x-ray, we'll take it a lateral with them looking straight ahead. And in today's world, so when I started practicing in the 90s, we would take these x-rays and we would see some forward head tilt, some reverse curve, and it was typically due when we would check their history due to car accidents and whiplash accidents. Today's world, it is different. We see not only adults, but not only is their forward head tilt about, it used to be about 6 to 12 millimeters. We're looking at an average of 15 to 20 millimeters forward on people. And that's a lot. So when they did the research over the last decades with whiplash accidents, they have found once that spine is off, you end up putting stress onto the back of these joints and the back of the disc. So there's pressure, added pressure onto these joints. If a person, also say they have one hip that's higher than the other, well, automatically what will happen is this bone, the sacrum, is tilted. Because this tilts, the spine starts heading off in this direction. There's a thing called the righting reflex. We want to be upright. If we're not, we're going to walk around crooked. So we compensate. Sometimes we compensate once, sometimes twice, sometimes 3 times. You have that whiplash accident possibly. Maybe you're behind your desk all day long. There's a lot of things that can cause the spine to shift, not just accidents. So when we check a patient in our office, as I mentioned, we look for 2 things. We're going to look for position of the spine. That's the first thing. So if we see one hip that's higher, and they're going to stand because we want to see how gravity settles. So we want to feel their hips. If we have one hip that's higher than the other, we know that there's at least one subluxation going on because it's tilting their spine. We'll feel it depending on how it compensates on the way up. Depends on if we're going to x-ray that area or not. Because once we know there's misalignment, there is also research that talks about, on average, how long it takes to start to break down those discs and joints. Because if you distribute the weight equally through the disc and the joint, and you move around throughout the day, your spine will age nicely. And we've seen this in our office. I've had patients in their 70s, been taking care of their spine for decades. They have a very, very healthy spine, which what we call is a normal. Doesn't matter the age of the person, like I said in the video, that will not determine the amount of degeneration. So I've had patients come in their 70s here. I've had patients come in their 70s here, 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 and here. I've had 50-year-olds come in here. So let me explain this a little further. This is a side view of the neck. Nice forward curve. They don't have that forward head tilt where it's out here. This C1 is above C7. So that's position. Condition is nice, open, healthy disc spaces. And then afterwards, if you want to come up closer and look at that. Here is somebody we consider at phase 1 of what's considered degeneration. Basically, it's osteoarthritis. This person, they no longer have that curve. They've actually come this way and they actually reverse. What's happening is there is structural, it's just physics, there's structural stress being put into the joints and the back of the disc. On average, this was a research study that was done, on average it takes about 18 to 20 years of that stress on that joint, of that person moving throughout the day, creating friction. And what happens when, and this starts within 7 to 14 days. So once a vertebra rotates and it's stuck and it can't get back on its own and that person starts moving, they're creating friction, shearing to the disc and the joint. So just like if you start working out, you go to the gym and you're going to create friction when you work out, your body will respond by laying down scar tissue or callus. Well, there's also, if you go barefoot, same thing. Say you go on vacation for a full week and you go barefoot during that week. By the end of that week, you're going to have a pretty good layer of callus on the bottom of your foot. Well, research shows within 7 to 14 days of any misalignment, it starts to lay down what we call fibrotic tissue on top of the cartilage in the joint and wherever that stress is around the disc. It's a coarse tissue, it's dense, and within 7 to 14 days it starts laying down. As long as that stress is there and that motion, it continues to build up, build up, build up. Eventually it starts to break down the cartilage, breaks down the disc, pulls calcium out of the bones, and that whole process is called osteoarthritis. So that's what we're looking at. So here's somebody who's lost this curve. Phase 1, we see position is not good, but condition is still pretty decent. They still have some decent disc spacing going on. Phase 2, on average, it's been about 20 years of this misalignment. They have lost this curve, so position's not good, but now we start to see this disc space is really breaking down. These are bone spurs. The back of this disc is breaking down, but as we work our way up, that's not as bad. There's a little bit of calcification building up here, a little worse in the back here, and then this disc is very healthy. So arthritis is not due to the age of a person. If it was due to your age, every disc in your body would just wear down because they're all the same age. It's the age of the stress and that friction going on that determines the amount of degeneration or breakdown that will occur within the spine. Unless you remove that stress, it just continues to wear down. The next phase you can see is pretty advanced. This is all bone growth laying down here, bone spurs. This is further degeneration of the discs. It's working its way up. Back of the disc, this one's bad. But this disc is as healthy as that disc. It has good spacing. And then the last phase is fusion. And I have patients that walk into, just recently I did a talk and the woman came in and we took an x-ray and she is fused and she had no idea. And she barely has, she just has stiffness and soreness. She came in because of her low back, because she had pain. And that's why they call it the silent subluxation, because you don't necessarily have pain with a misalignment. And I'm going to get into that in 1 second. So this is structurally what we look at. So as I mentioned, when a patient comes in, we just want to know what is the position of their spine and what is the condition. So we check them, we palpate. If they're misaligned, we take the x-ray. That tells us what's going on. Then we do some neurologic testing. We will test motor nerves because we know specific nerves that go to specific muscles. And this happens all the time. Patients are blown away. They'll do something and it could be their dominant hand and it's weak. And their other hand, they're like, that's my dominant hand. I had no idea that I was weaker. There's sensory testing that we do for dermatomes to make sure that there's sensory nerves going to where they're supposed to. So in the video, they talked about the central nervous system. Does anybody have any questions? Because I'm going pretty fast. As far as the structure of the body, position and condition. Arthritis, any questions on that? Okay, so the central nervous system. Like the video talks, and the reason I play that is it makes my life easier. It has great visuals. But I'm going to get a little more specific about what he was talking about. So our brain is our central command center. It controls every system in our body. our nervous system is all part of that. So it controls our digestive system, our cardiovascular system, our immune system is controlled and coordinated by our nervous system, by our brain. The way the brain coordinates and communicates with the whole body is through the spinal cord. The spinal cord branches off and becomes spinal nerves between each vertebrae. From there, these nerves branch off to every nook and cranny of our body. If we removed everything from our body, all of the other tissue, and just left the nervous system, you would know, you would be able to identify that person when you look at all the nerves and where they travel. So these spinal nerves then branch out and go to every nook and cranny of our body. So when you look at the spinal nerve, each one of these nerves is like more like fiber optic, but I have I'm not plugging Verizon, but they did give this to me. So this is a phone cord. It has, I've been told, never count them, 1,000 individual wires. Each one of our spinal nerves that branch out on each side of the body have over 100,000 individual wires, or what we call nerve tracks. Over 100,000 each one. So all the way down, each one of these nerves have over 100,000 individual wires on each side. It's amazing. So when you look at any one of these nerves that come out, there's 3 major portions to each one. You have your motor nerve function, so we know in the neck, these are nerves that go down into our arms and hands, control muscles, low back, legs and feet, and then in between. You also have sensory nerves. Sensory nerves are the same type of distribution, where coming out of the neck, arms and hands, low back, legs and feet, and that's the dermatomes, and that's for touch. So out of sensory nerves, you have vibratory nerves, which are for touch, that's what you feel. You have pain nerves, which we only know too well, but out of all of these nerve tracts, they're only 10%. Then we also have temperature for hot and cold. If you put pressure, interfere with that nerve function, either due to rotation, lateral flexion, or stenosis, breakdown of the disc, which is the arthritis is causing that. It's that wearing down. If you affect the motor nerve, you will never feel pain, but you will have loss of motor function. If you don't touch that and you only hit the sensory portion of the nerve, you'll have numbness and tingling. If you hit the pain, you have pain. If you hit pain and vibratory nerves, you'll get numbness and tingling with pain. And then temperature will throw off your sensory to detect hot and cold. Then the last portion, and the biggest portion of each spinal nerve, are the motor nerves and the autonomic nerves. Sensory nerves are actually a smaller percentage of each spinal nerve. But autonomic nerves are the nerves that control our blood vessels, our glands, and our organs. You can put pressure on autonomic nerve due to that rotation, lateral flexion, or stenosis all day long and never have any pain. But if it's trying to communicate and run, say, the lungs, the only way the bronchi dilate and constrict is through your nervous system. So if they're not firing, and when you put pressure due to rotation or lateral flexion, if you interfere with the nerve at this spinal level, it's not like an on and off switch, it's a dimmer switch. So you can decrease this by 10%, 20%. It just depends on the amount of pressure being put on that nerve and how it's affecting it. But we've had children, I've been doing this 23 years, so we've had children come into our office, no pain, but they have asthma, and their parents have heard that chiropractic can help. So I'm not telling that patient we're going to get rid of their child's asthma. I'm going to say let's check the position of their spine. Condition's still going to be good because it takes 20 years of wear and tear before we see the arthritis. But you'll see rotation or lateral flexion, any kind of a curve. And if they're misaligned there, no matter what, even though I may not be trying to, I can't say I'm curing, because we don't know, we're not advanced enough in our culture yet to be able to measure which nerves, how they're being affected yet. It's too difficult. But because of that misalignment, we want to remove that misalignment for 2 reasons. We want to get pressure off the nerves, but we also, as that child ages and they have stress on those joints and that rubbing, they're leading towards arthritis. As they're growing, they are going to start to break down their joints into their 20s. And I see that. We have 20-year-olds come in and they are already into a phase 2. So if it's the mid-back, this is what controls digestion. The only way your body's going to release pepsin or hydrochloric acid is through the nervous system, the brain being told there's food coming down, there's sensors, okay, it's time to release the hydrochloric acid. And then also on the flip side, you have goblet cells, which release a layer that secrete your stomach to protect your body from that acid. The only way that they're going to secrete is due to the nervous system telling what's happening, that it's time to release that. All functions, pancreas, digestion. Digestion's a pretty easy one too to really visualize, is because your intestines, they're going to push the food through your body. It's called propulsions. I used to know really. So what it does is it squeezes. There's all these muscles and it pushes the food through. It also releases fluids. It also, that's majority of your water is absorbed in your intestines. It's like 80% of your water that you absorb occurs in the intestines. So if it's not absorbing right, so say it's absorbing too much, you could have constipation. Say it's not absorbing enough, you have too much fluid, that's diarrhea. You've ever heard of Crohn's disease? It is a neurologic disease. That's its classification. So when a patient comes in, when we do a history on them, we're going to check, as I mentioned, their spine. We're going to see what's going on. There are times I've had people with irritable bowel, colitis, or Crohn's. Now, I'm not telling them we're getting rid of this. We let them know if you're affecting the autonomic portion of that nerve, there's a good chance that your body's not working right and causing this situation. Either way, we're going to check your spine, adjust you, we re-x-ray. So after so many visits, based on the amount of damage that's been done to the spine, your body is self-healing. So once we start adjusting, we're going to not only stop this from getting worse, we're going to start to reverse this process, and then we will re-x-ray, where you'll see disc space is starting to open as the spine is correcting. And then we check in with their symptoms. And I've had patients with Crohn's completely, like 52 pills this guy was taking. And I said, just talk to your doctor, let them know. And this was back in like 2001, 2002. So it was 52 pills he was taking each day for his Crohn's. He got to the point he only took one, but he said, I'm not having symptoms, but it was almost like a safety blanket. And I go, do whatever you want. That's fine. One is better than 52 if you don't need it. Asthma, clearing kids out from using their dilators. So whatever it may be, we've had people with bladder weakness that they will come in there and they will tell me, they'll say, I really didn't believe you when you said this could happen, but it made sense. But I am totally doing better here. Allergies are a big one. Your first line of defense is your sinuses, mostly your sinuses and also your oral cavity. So when you breathe in allergens, your body needs to respond to that. And it's called immunoglobulin E's, is a big portion of your immune system. And that's what is part of the body's response to fight off allergens. And if your body doesn't have the right amount of IgEs, which then cascades and creates mast cells, which all this is what fights off these allergens to keep your body strong. If there is an upper cervical misalignment, we have had many patients, because it's so common, allergies, and then they'll have headaches, not always. Sometimes they only have allergies, sometimes they get migraines in conjunction with it. But all we do, we check position, condition as we're adjusting them and correcting them. We check in with them. And we've had people completely clear out of allergies too. It's not always the case because there are other causes, but we are looking to correct their spine. So they age well and their nervous system's firing better. Okay, I've covered a lot of ground. Any questions? Yes.
So even at an older age?
It doesn't matter your age.
Can you really go from like phase 4?
No.
Or 3?
Okay, so this is great. So I go over this with each patient. So phase 1 is the easiest to correct. And when they did the research, on average, they determined there's a certain number of visits and a certain number of time that's going to bring the spine back to this position. you can do the same thing in phase 2. These cells will regenerate. Your disc cells, your cartilage cells are constantly dying and being replaced. But they cannot be replaced when there's constant friction and tearing down going on. So these cells will regenerate. We see the disc spaces get more open, so you can do it in 2. When you get into early phase 3, there's limitation to how much these discs, because it's called limitation of matter, these cells start to lose their ability to regenerate with that much damage. But what we see in a phase 3, early phase 3, majority of patients get to about the middle of a 2, and then those disc cells just can't regenerate any further. But we're working on getting correction. Phase 4, we cannot move bones that are fused, so I refer them right to a neurologist depending on their symptoms. Even a late phase 3, I will refer them based on what's going on with them. So say they have sinus issues, I won't refer them. Say they came in, I have all these sinus problems, but they have misalignment here. They have a healthy disc. We can reposition. We can get pressure, but there's no change here. So that woman that's coming in, she has fusion in her neck. She came in with her low back. Her low back does not have fusion. She's pretty degenerate. She's like in an early phase 3 in a few of her spots in her low back. Not all of them. Some are 1. But so I can't even touch her neck because I can't move them. But we're working with her low back and her mid back. So, and yes.
Does the patient feel pain when you make an adjustment?
Okay, get that question all the time.
Yeah.
So, when there's irritation to a joint, if there's a lot of inflammation in that area, it's already sore. So there's some patients, I'm just barely touching them and they're like, ooh, that's sore. Or if that muscle's been under a lot of tension, it's released a lot of lactic acid, hyaluronic, for trigger points, along with inflammation around the joint. We have to work with them. There's a lot of tissue work that we'll do before our adjustment, and there's different ways you can adjust. Some patients I might use an instrument. It's very low force, high amplitude, low force. So the force will help shift that bone until we can get them further along and out of their symptoms. Majority of my patients, I do use my hands. I like to use my hands and give a manual adjustment. I like it because I can feel it. You know, you can really feel that move. And then I'm also testing the motion of that joint. Because joints that have degeneration, you're trying to move that bone, it's limited on motion because it has all that fibrotic tissue that's built up around it. So we want to restore proper motion. And that's one of the first things that patients will say to us is, wow, I don't have to shift my whole body to back up. I can really start getting better range of motion and they're looser. So it depends. Now we try to limit, so we have to adjust our technique. But once we get patients going, it can get a little sore. So what I tell patients, the first 3 visits is the way your body's going to respond is like you worked out. So if you've not worked out in a while and you go and you work out, you're going to have soreness and achiness. It's because we're breaking up tissue. We're breaking up that fibrotic tissue. So that's a typical response to what patients feel. And I have kids, I have toddlers, we adjust them because they fall all over the place. You know, kids, and their hips are off. And so when I have patients that come in and they're in their 20s and they're already in a phase 2, they've been misaligned since they were young because it takes about 18 to 20 years for this to occur. So their misalignment started when they were from falls that they had when they were young. So I have kids that get, like, they'll jump up on the table and they're like, it's my turn, and they have siblings. So we get that. We also have kids that are just kind of freaked out. And they're like, no, you go. So we get both. But it is safe. So one thing that patients are always, because usually a lot of patients that they've tried other types of care and they have not been able to get the relief. And they'll come into our office and they are nervous and they are scared, but a friend has said, go, it's safe, but they're scared because it looks freaky when you adjust the neck. So the only way that patients believe me, that's if they can hear me because they're so scared, is so everybody needs liability insurance, malpractice. So we know a family physician, back when I looked at this, it was about 10 years ago, it was about $25,000. $23,000 to $25,000 is what a family physician had to pay annually for their liability insurance. Then we know about obstetricians. Remember obstetricians? They were like 85, 90,000. They were leaving the state. So this is based on occurrences. That's how insurance companies determine their rates. So just take a guess, because this is part of the fun of the chiropractor. Take a guess, and I have full amount of coverage. It's $3 million. That doesn't mean you need to come in and test me. So $3 million full coverage. Take a guess on how much per year I would have to pay, that I pay. And I've been practicing for a while, which helps too.
8,000.
No,
Less.
much less.
3,000.
About $3,000. I pay $2,300 per year, full coverage.
That's amazing.
Chiropractic is not harming. It's freaky to watch, but it is not harming people because insurance companies is based on occurrences, and if we're not harming people, they're not doing it. They're not charging us the rates, and that's full coverage. So a kid out of school might pay a little more until they get some years under them without any occurrences. Okay. So that's, yes?
You pop and crack or?
So, okay, good question. So, cracking and popping, what that is, it's called cavitation of a joint, and we don't care if it pops or not. So what we're looking for is motion back into that joint and to get it back towards the direction it needs to go. So, remember I talked about you have 4 joints inside each joint, you have that synovial fluid. So when you have rotation or lateral flexion, you're going to create jamming on, and they call it facet imbrication, but they have jamming into these joints, and there's typically some sort of gap on the other side, especially with rotation. Because when it rotates this way, it's going to jam on one side, and it's going to create a gap on the other. And later on, if you want to see this, I can show it to you. So that person's walking around, has this rotation, then they're moving throughout the day. They're creating friction on the one side, and this fluid is going, this joint on the other side is going back and forth. With movement in fluid, it starts to build up gas inside that space. It's nitrogen and carbon dioxide, is what they tell us. So when that builds up, you'll see people crack their own necks, or they'll crack their backs, because when they do that, that pressure, because there's sensory nerves around that joint, and as gas builds up in the joint, it's going to build up pressure, and so they want to release that pressure. So they've learned if they do that, they're going to push gas out. The only problem is they're not re-educating that joint, because you have muscles, tendons, and ligaments that have conformed. Some of these ligaments and muscles have atrophied, other ones have been stretched out. So that's part of what's holding that joint out of position besides that fibrotic tissue that's been building up around the joint. So what they do is they go, by doing that, they're just mobilizing that joint. They do nothing to re-educate it, so they'll never correct it, and they're actually creating more stress in one direction in that joint, which actually adds more fibrotic tissue to lay down into that joint. But they feel good because they release that gas. And before I went to a chiropractor, I was doing it all the time because I had these misalignments that were building up the gas. And my chiropractor wasn't as nice as I am because I informed him about it. He told me, you need to stop because you're working against me. But, so, that's what that gas is. So popping, and it's just a release of gas. So when we adjust the spine, the only direction we're ever moving that vertebra is back towards neutral. And there's 2 ways you can do it with your hands. You can either come from one side and push it, or you can come from the other side and pull it. It depends on the tightness of the muscle, what's going on with the patient, if you're going to pull it or push it. But it's quick. As I said, we get kids, we call it popcorn, makes it friendlier too. But it's in their head, it just seems nice. It's popcorn, has nothing to do with how it feels. Because they're fine with it.
What muscular work do you do? Because, prior to the adjustment, you said that the neck's really tight.
I'm going to stretch it. There's all kinds of techniques. When I was in school, they didn't have this thing called ART, active release technique, but we were doing it. But there was somebody that put a name on it. But essentially, we want to get motion. So I'll do cross friction. So a muscle that's building up. So in muscles, it's a little different. It's more like collagen is what will lay down and get interlaced. So muscles are linear fibers. And what happens is when there's trauma, the body just sends this stuff to try to protect it, and it gets interlaced like a matrix. That's how people lose that motion, it doesn't want to stretch in that muscle. They start to lose that elasticity. So cross friction is a technique where you're kind of working against that. There's different ways. I have patients that will use a tennis ball at home, IT bands, different muscles, and they'll go across the fibers. Then you've seen the foam rollers where they roll in direction of the fibers. That's all beneficial. And then you want to elongate that muscle after you break that up just to restore motion. So when a patient's on the table, I'm going to break that up, do some cross friction on it. I'm going to stretch it, elongate it, and just get that muscle to start to relax so the adjustment just goes easier and it doesn't fight back as much.
So is
That's why.
Is massage part of, do you have massage work that's done other than that?
Well,
You're
when a
on-
patient's really, we have, there's a couple different massage therapists I refer to. One, Amy Kraft, she's awesome. She's in this area. She's been working with the Eagles for years. And she's awesome. She's a patient of mine, and we refer to her because her experience is phenomenal. There's another one called KB. Her name's KB. She's out there. So I am familiar with their work, and that's why I refer to them. But yes, it just helps that whole healing process so much faster. So does good nutrition. I mean, that all plays a huge part. Stretching, yoga. Yoga is phenomenal. But that's what we want to do. We want to restore motion to the soft tissue to allow that spine to shift. So in our office, we give specific things to do at home. Because when this research study was done, it wasn't done with the patients doing any kind of soft tissue work. It was strictly adjustments. They have found when you do these added stretching and working with the ligaments, tendons, and muscles, you will restore correction by over 50 to 60%. That's how important the soft tissue response is. And it's all about re-educating all that soft tissue to allow the bone to shift and settle. Okay? Yes.
I guess it probably depends, but on just relatively speaking, how many visits before the second x-ray?
So on that, if someone's in a phase 2, you're looking at either 18 to 24 visits before the first re-x-ray, and that's 3 times a week. So the analogy is if a patient is out of shape and they want to go to the gym and they want to get in shape, if they work out 1 day a week, they're not going to create much physiological change to their body. If they're working out 3 days a week, that's the only way you create change. It's repetition, and it's all about re-education with working out. It's about cardio and burning calories too. But so we will, and we have patients, they come 3 times a week. If it's 24, which is towards the end of phase 2, we'll re-x-ray and they'll see, they've been there, they've been doing their stretches, we're adjusting them, they'll see the change occur, but they'll know, oh wow, it really did take this long for the body to respond. And they followed it. And then we go down to 2 times a week, and that's more of a longer period of time, and then 1 time a week, and that's once they're back here. We want to stabilize them, give them some exercises. Once they get to that point, we want to now strengthen and stabilize. We don't want to strengthen it while they're here. We want to, so there's some offsetting exercises because you have weak muscles in some areas that you'll strengthen. The other ones you want to release.
How long is the session?
An adjustment can take anywhere from 5 minutes to 10. We also do what's called intersegmental traction, where they'll lay on a table and it just pushes up into their spine, and it's just, again, to work with the soft tissue. Now, ligaments are the hardest soft tissue to change. Muscles are the easiest, then tendons, and then ligaments are so dense. And research shows you have to put that tendon under stress for, on average, 18 minutes before it starts to change. So when we have patients, when they have forward head tilt or that reverse, they're going to be at home and they're going to lay on a neck roll. Once they can't always get to 20 minutes in the beginning, they might can only do 5 minutes, but they'll see how their spine is healing and the soft tissue is changing. They'll get up to 20, and they do that repetitively, and that's a great way that we help to get their curve back much quicker than just adjustments. There's things, people have a lot of hyperlordosis. They end up creating a lot of wedging to the low back. So they do this, it creates a lot of wedging on the back of the disc, and this starts to wear down. There's just simple exercise. You bend your knees and make sure your knees are always bent, and then you push your back flat, and And it's an easy exercise, because people, when I show them, they're like, that's all you have to do? And I say, yeah, because you were just stretching these muscles, ligaments, and tendons to re-educate that, to help restore that curve. It's harder to, with stretching. There's different muscles you can do, like the psoas muscle, piriformis muscle, which is back here, to help with tilting of the hips. Those help as far as we'll give different things to do with the patients for those stuff. But it's all about getting your spine back to neutral, so as you age with healthy joints, healthy discs, and a healthy nervous system that's able to fire properly. And that's why they said that study, people who are sicker less, they're healthier, people who are doing more of a wellness program, keeping their spine. So once a patient gets back here, we put them on what we call wellness. Now wellness, ideally, is every 14 days, because fibrotic tissue lays down within 7 to 14 days. So if a patient's coming in every 14 days, not only are they preventing this from occurring, but they're also allowing their nervous system, if there is some misalignments in between, just to be firing properly. Not everyone does some people go once a month, some people go 4 times a year, some people, but they can still have, but they're going to slow down this whole process by doing that. Okay, so that's all my information. Any more questions?
I've
Yes.
done those simple exercises.
Yes.
And it got rid of my hip pain.
It helps.
It really helps. And
Is
it's
that
a
tissue?
discipline, yeah, it's a discipline, yeah. But it took about 2 months before I noticed the hip pain went away. But the pain was so bad, I had to do something in addition to your adjustments.
Yeah, so there are, and I'm not saying, there are certain people that, if you're falling here, we're never going to get you here. But we're going to do as much as we can to relieve your pain and prevent it from getting worse and try to get it at least to this point. So there are patients, when they get into these later phases, it's the soft tissue, there's been so much damage. It takes a while to get that to respond.
You keep saying we, how many of you are there?
Well, there were 3. August 21st will be 2. One of our chiropractors, he's from Australia, he practiced there for 16 years. He came back, he's actually the one who told me about this video, it's a great video, I think. So he had to go back, because he has kids, long story short, kids like America, they've been here for like 9 months, they want to stay, so he had to take care of business and he'll be back August 21st.
So there'll be 3 of you then?
Well, there were 3.
Oh.
We had a guy, he was great adjuster, but he went to school with another guy who went down to Florida, practiced with a guy. That guy turned around and said he wanted to sell his practice. And his buddy said, hey, come join me. So that was a horrible loss, because we really liked him. But we're looking, I want to always have 3.
So right now you have 2?
We have 2. Well, August 21st we'll have 2.
Oh, so there's 1 of you right now.
Right now,
and
I'm
then
tired.
You're so then you're gonna have 2 on August 21st, okay.
Yeah, we went from 3 to 2, and then Andrew was the one who went to Florida. He was trying to stick it out, but Dr. Billy was selling, he had a practice back there, and I'm like, oh. So we've been without him for about, 4 weeks? Feels like a lifetime.
Yeah, not quite, but yeah, it's a lot. It's a big
Yeah,
switch.
so that those numbers.
And how long have you been in whatever site you're at?
So we've been in Phoenixville. I practiced in Westchester for 10 years. I actually had an injury, pain, couldn't adjust. I ended up selling my practice, took care of my injury, and then had a restrictive covenant. Came up here to Phoenixville in 2009. January of 2009 is when I opened up. I used to be across from
When it was Gennardi's.
when it was Gennardi's, that shopping center. Now there's Planet Fitness.
Is that where you are?
No, then we moved, do you know Foresta's?
Yes. Yes, I know Fresno's.
Yes. We're in that
you're
white
big
building.
white building?
Yeah, with the
It says
green shutters.
chiropractor?
That's me, that's us.
Now I know where you're at. I've gone by
Yeah.
that building going, there's a chiropractor.
Yeah, it's haunted.
Especially around Halloween.
Yeah. No, people have told me, patients, and then we've had people that clean it at different hours and they get freaked out. Yeah. Yeah.
Question.
Do it goes through adjustments?
I wish, especially right now. That'd be great.
Can you give me your opinion on that? I've had the technique where they lower, they stretch the thing. No,
Oh, the flexion distraction?
The flexion distraction, do you do that?
I do. It's
Oh,
great for
I
the
love
lumbars.
that. Yeah.
Yeah, it's a great way to stretch those muscles.
Yeah.
I didn't have that for years, like maybe 11 years. And then there's a technique, it's called Cox.
Yeah, Cox.
So I went and took that technique, and then, the changes I saw
Yeah, I
with
love that.
patients, their response was because you're working soft tissue, which just
Yeah.
speeds up the process.
Okay. Well, that's good to hear, thank you. I
Yeah.
like that.
Does Medicare A or B cover your
Was it A?
Yeah, Medicare.
How much
It was
of
A or
Do you
B?
mean a supplement or just A?
No,
Uh,
supplement,
A
just
is-
A.
Just A,
Just
yeah,
A? It
yeah.
does?
Yeah, 30 visits on average is what, per calendar year, is what they'll cover.
Really?
Yep.
They don't cover anything else.
Well, 30's like not even once a week, so. How
Yeah.
do you do plans for the rest or what?
Yeah, we have costs for senior citizens, we have costs for college students, and then we have adults, which it's less than what we get paid for by the insurance companies, because it's less work for us to do. So we have a
Yeah,
savings back.
less paperwork. And what we do, I think that's
Yeah.
different than a lot is we'll, Dr. Jim or whomever will figure out what kind of care, your length of care, and explain that to you. And in the process, the admin team is figuring out what your insurance will cover and what it won't cover, so you're not coming in blindly. You always make sure you know what's going on financially.
So on your first visit, a patient comes in, I do an exam.
Sorry.
That's when you give our front desk your information as far as insurance. By the time you come back for your report of findings, they will have it. What I do is, I do the exam, if we take x-rays, then we schedule that next visit, because I want to analyze and I want to go over the x-rays and the exam with the patient. So after I determine their treatment plan based off of their x-ray and their exam, then I give them the sheet, and then they have it ready for when the patient comes in, as far as how it's covered.
And then what happens if your treatment plan doesn't match what they'll pay?
It often happens. I'd say it often, especially if they're phase 2.
The patient has to start paying, right?
Yeah, so we have a lot of
Patient
patients.
covers
Yeah, that pay that's so many of our patients, but insurance, they cover symptomatic phase pretty much. That's all they care about. They just want to get you out of pain. They don't care about the long-term correction. And we have some patients that only come in for the symptomatic. And what I tell my patients is, you can do, I'm not offended. You choose whatever you want. This is just knowledge. Do with it what you want. We're not going to pressure you and say, hey, you need to do this. It's your decision. But I don't want patients coming in thinking that they're feeling good and they think their spine is healthy, because they'll be out of pain before their spine is back here. And what happens, so say a patient comes in late phase 2 and they get to about here, they get through their symptomatic, you'll see the changes. I'll see the changes. Say they say, I just want to do symptomatic, they're only going to be so far. So they have not taken all the stress off those joints. So it's a matter of time before that pain just comes back, because they never got all the stress off the discs and joints. So it's going to, every 7 to 14 days, it's laying down that fibrotic tissue, and they're just going to start heading back in that direction. Once you get here and you maintain there, that's going to be a healthy spine. I have some patients, they only get to here, they're trying to maintain, and we're going to do our best, but it's hard. So say they're a phase 3, and they can only get into a 2. They're out of pain, so they're maintaining their pain, but their disc just won't regenerate anymore. But does that make sense?
Mm-hmm.
So I'm always happiest when a patient's here, because we know we can get them there.
What about if you've had previous back surgeries?
It depends on the surgery. So if they've had a discectomy, we'll completely adjust in that area because it's safe. If they've had fusion or bolts, we can't touch it. We've had people with hip replacements, we can still work on their sacrum. So I have this one, he's young, he's a school teacher. He's had fusions in his he was in a horrible accident. He's had fusion in his neck and a portion of his back, but we work above the fusion and in between and below.
Okay.
Well, thank you very